Hello, everyone. I hope you're doing well. This is Okiraku-Radiology. Let's take a look at another case today. First, I'll run through the images quickly. So, were you able to figure out where the lesion is in this case? Because this case uses MRI, there are many different types of sequences. If you'd like to scroll through whichever images you want, just like in a clinical setting, please check out the trial linked in the description. All right, let's interpret the images together. In MRI, we acquire various images called sequences, each displaying different contrasts, and we read the necessary information from each image and combine it for evaluation. Basically, we start with T2-weighted imaging, which highlights water content, and T1-weighted imaging, which highlights fat. From there, we suppress unwanted signals or add features that reveal special information in order to obtain images tailored to the diagnostic goal. It's a complex examination. The current image is T2 flare, which often renders areas of encephalitis or other inflammatory lesions as bright regions. Where are the hidden findings in the image? There doesn't seem to be any area of concern. On the flare image, there appears to be nothing specific to point out. Next, let's look at this image. Diffusion-weighted imaging. To skip the technical details, this sequence tends to show regions where neurons have been damaged, such as from stroke or brain tumors, as bright areas. A quick glance here shows no obvious abnormality. There isn't any apparent acute lesion destroying brain cells. Now, let's move on to this image. This is MR angiography, or MRA, a sequence specialized for visualizing intracranial vessels without using contrast. You can't see much of the rest of the brain. Only the vessels appear bright. Let's scroll through it. Do we spot anything concerning? Yes, right here. This portion shows a vessel abnormally dilated and unnaturally large. This is a cerebral aneurysm. So, what exactly is a cerebral aneurysm? Take a look at the illustration. A cerebral aneurysm is a segment of a brain artery that balloons out like a little pouch. The aneurysm itself usually causes no symptoms, but if it keeps enlarging and ruptures, it leads to subarachnoid hemorrhage. Subarachnoid hemorrhage has a very poor prognosis. It's often said that 1/3 of patients die, 1/3 have permanent sequelae, and 1/3 are able to return to society. Hence, with cerebral aneurysms, the key is not to ignore them simply because they haven't ruptured yet. We must monitor them closely and consider preventive treatment to avert rupture. The exact reason a segment of a vessel balloons out isn't fully understood, but congenital strength and elasticity of the vessel wall, along with hypertension, arteriosclerosis, and smoking, are believed to contribute. Next, let's examine an illustration showing sites where cerebral aneurysms commonly occur. Most of them arise at arterial bends or branch points. In other words, areas repeatedly hit by blood flow over the years tend to bulge. If you have hypertension, the force of impact is stronger, making bulging more likely. And if atherosclerosis or smoking weakens the vessel wall, that also raises the risk. Now, let's analyze the images in more detail. As noted earlier on the MRA, we see an aneurysm involving the right internal carotid artery. In technical terms, it arises from the right ICA's C1 segment extending toward the ICPC junction. Here's an illustration of the cerebral vasculature. The aneurysm in this case is located right here. This vessel is the right internal carotid artery, near its junction with the posterior communicating artery. Taking the initials of internal carotid artery and posterior communicating artery, we call this the ICPC junction, and it's a classic site for cerebral aneurysms. Let's confirm the aneurysm on a 3D reconstruction. When thin, vessel-focused slices are stacked, you can observe the vasculature in this three-dimensional manner. On the 3D image, the large aneurysm on the right internal carotid artery is clearly seen. Here's another 3D reconstruction, this time with color coding to resemble vessels. You can still clearly visualize the aneurysm. Let's measure its size. Here is the measurement. It's about 6 millimeters, not ruptured yet, but fairly sizable. Larger aneurysms carry a higher risk of rupture, and when they rupture, they tend to bleed more profusely, so careful attention is needed. Since we have the opportunity, let's compare what the brain looks like when a cerebral aneurysm ruptures and causes subarachnoid hemorrhage with what it looks like when it doesn't. The left CT image shows a brain without subarachnoid hemorrhage. The right shows one with it. On CT, blood appears white. As the term suggests, subarachnoid hemorrhage refers to bleeding just beneath the arachnoid membrane that envelops the brain. Large intracranial arteries travel through this space, so when an aneurysm ruptures, blood accumulates along that pathway. There may not be an obvious mass effect from the blood on the brain parenchyma, but in reality, the intracranial pressure skyrockets due to the massive hemorrhage. The brain parenchyma, trapped inside the skull with no room to expand, is constantly squeezed and suffers ongoing damage. In the normal brain on the left, the subarachnoid space is filled with cerebrospinal fluid, which is similar to clear water, so there's no blood and it appears dark. On the right, where subarachnoid hemorrhage is present, the subarachnoid space looks white from the blood. Even though blood should be diluted by cerebrospinal fluid, it still appears white on CT, which indicates a significant volume of bleeding. The poor prognosis of subarachnoid hemorrhage stems from the brain damage caused by this hemorrhage volume and from subsequent complications such as hydrocephalus and vasospasm. Because subarachnoid hemorrhage is such a severe condition when it occurs, if we are fortunate enough to find an unruptured cerebral aneurysm, we monitor it annually to see whether it grows, and we consider preventive surgery to avert rupture if necessary. Surgical approaches depend on the aneurysm's location, size, and shape. Treatment options generally include endovascular coil embolization, in which a catheter is used to fill the aneurysm with coils to block blood flow, or surgical clipping, in which the skull is opened and a clip is placed directly on the aneurysm to occlude it. Because each case differs, patients must consult a specialized medical center. How is that? This is how we interpret MRI images in cerebral aneurysm cases.
Introducing Okiraku Scroll Viewer. Have you ever wanted to scroll through the scans yourself while watching imaging videos? Once you hear the answer, it sounds easy, but when you try to interpret the images on your own, it can be quite challenging. Still, if you form your own differential and then check the answer, your reading skills improve dramatically. Watching someone else scroll makes it hard to read. That's why we created Okiraku Scroll Viewer, a specialized training site for imaging interpretation. Just like in a real clinical setting, you can scroll through the images freely. It includes various cases and their answers. By scrolling yourself, making your own diagnosis, and then checking the answer before reviewing the images again, you're guaranteed to get better at reading scans. If you're interested, please jump to the link in the description and try scrolling for yourself. You can use it on both your phone and your computer. See you in the next case. Until then.